Hello everyone, thank you for giving me the opportunity to present our study at the APACC conference. So my name is Zhang and I present this study on behalf of Nanjing Pay It Forward team. So before I start, I would like to introduce some background of this study. China has the highest number of HBV and HCV cases globally, and however, there were low rates of the HBV and HCV testing in China population, including among men who have sex with men. And same as the other at-risk populations, MSM are often discouraged from taking HBV and HCV testing in clinic due to double discrimination against their sexual orientation and hepatitis status. However, there are lack of public funding for implementing people-centered HBV and HCV testing surveys within LGBTQ community in China. So our research problem is there are low testing rates for HBV and HCV testing among MSM in China. And Pay It Forward is a promising approach to solve this problem. So the process of the Pay It Forward, it has one person receive a gift, and it can be a health service like testing, and from someone who care, and then ask if they would like to give the gift to another person in their community. It offers participants an opportunity to receive a subsidized health service and to generate a sense of warm glow in the society. So previously, the studies has demonstrated that Pay It Forward approach can successfully increase in the gonorrhea and chlamydia testing uptake, as well as the flu vaccine uptake. And also, studies suggest that it can improve community engagement and also help the society to decrease some of the financial barriers to health service. But the remaining question is if the Pay It Forward can apply to other infectious disease such as hepatitis, and also if it can embed it in the routine health care service. So to test this research question, we are used the adapt Pay It Forward approach, which is integrated in the community-led HIV and STI testing service. So a community-led model is one of the people-centered design that surveys are determined by and response to people's needs. In other words, it empowers key population to self-design culturally sensitive health surveys and take the ownership of running the designed surveys within their community. Based on this concept, we conducted a cluster randomized trial in Jiangsu province in China, and we selected two MSM led CBOs who providing regular HIV and syphilis testing service among MSM. And the intervention materials are designed and prepared and distributed by the CBO themselves. And the surveys were distributed within their routine HIV and syphilis testing surveys in the CBO office, as well as the outreaching sites such as pub and club. So specifically, a group of 10 participants are randomized into arms. The first arm is standard of care arm, where the participants receive the information of hepatitis testing, and then they were asked if they would like to get HBV and HCV testing out of their pocket. The other arm is Pay It Forward arm. So participants were also given the information of hepatitis testing. And also, the community staff are generating really encouraging stories of the Pay It Forward concept, and from the previous trial as well as from the other field to really help the participant understand what is Pay It Forward. And then the participants would receive the free, like the HBV and HCV test, which are paid already by the previous participants, along with a postcard with some encouraging word from their peers to encourage their testing uptake. So our trial was run from the March 2021 to November 2021. And here are some results of our study. So first, within overall participants, we can see that it's about 25% of men in standard of care group received the HBV and HCV testing. But in the pay-it-forward group, there were about 59% of participants received the testing. The proportion difference was about 34%. And we found consistent finding within different testing scenario and within different subgroups. The largest difference was found the people who recruited from the outreaching sites, as well as the people who ever used any illicit drug in the last 12 months. And there were 33% participants in the pay-it-forward arm choose to donate some money to the future participants. The total donation amount is about $500 US, and you can see the figure on the right. There was no difference in donation status was found by the study site and income level. So based on the analysis for cost testing for each group, the pay-it-forward model was more effective and cheaper than the standard of care group, considering the economic and financial cost. So our study showed that community-led pay-it-forward model dramatically improved HBV and HCV testing uptake among Chinese American men compared to the standard of care. The community-led pay-it-forward was effective across different testing modality and various subgroups considered at high risk of HBV and HCV infection. The total donations successfully helped offset nearly half of the total cost of the screening participants in the pay-it-forward group. And there are some implementations for the future implementation. So community-led pay-it-forward could secure financial resource and connect the marginalized population in the society, as well as well aligned with the community-led service. And I would like to acknowledge the Zhang Health Service and the Wuxi Caihong Health Service in Jiangsu Province, as well as our partner. Thank you.